Good morning, everyone. Good afternoon, good evening. My name is Ruth García Gómez, and I am the Business Development Manager for Aquatic Health and Farm Care Products for APAC and ISE regions under the Adisse business unit. And I'm going to present today a topic on preventive feed additive strategies to reduce the impact of co-infections and multiple infections in the production of tilapia and shrimp. This is the presentation outline, a summary of functional additives as a preventive tool, and some definitions regarding co-infections in tilapia and in shrimp, then the trial results for tilapia and shrimp, followed by some take-home messages. With regards to a clear key bottleneck in aquaculture, health management has been identified as a major threat for performance and profitability. Infectious diseases, of course, co-infections and multiple infections are extremely relevant, and they are getting more important every day. Emergent and new emerging and re-emerging diseases are appearing because of several factors: increased intensification, increasing stocking densities, for example, application of sustainable diets, high levels of stress, and of course there are strong limitations to the use of antimicrobials, including antibiotics, mostly driven by consumer demand, certification schemes, national and local regulations, and also antimicrobial use and antimicrobial resistance strategies, not only at local and national level, but sometimes at regional and global level. So there is no single solution for most disease outbreaks, and actually we know that antimicrobials can be part of the solution, but they should be integrated in a more holistic and preventive approach, and therefore there is a need to develop multifactorial solutions for multifactorial disease problems based on prevention, biosecurity, and better husbandry practices. The idea of the ecological triad, host, pathogen, and environment is no longer what we thought. Co-infections caused by secondary opportunistic bacteria or infectious agents and commensals are very common in aquaculture and aquatic ecosystems. If we think about preventive medicine in aquaculture and we compare with terrestrial animals, pigs, poultry, cattle, we can see that in terrestrial animals, the veterinary medicine and the preventive medicine specifically has devoted a lot of resources, has invested a lot of resources in epidemiology and early diagnosis, early warning systems, genetic selection towards pathogen resistance or tolerance, strong and consistent and robust vaccination programs, as well as improved on-farm biosecurity practices and better farm husbandry. Of course, functional additives are also a key tool in terrestrial animals, and a lot of research and development has been invested into the application of functional additives and functional feeds in all species of terrestrial animals. Are we doing the same in aquaculture? This is an important question for this presentation. Is the aquaculture sector investing sufficiently in prevention? If we compare our situation with terrestrial animals. So we have two possibilities to confront a disease or to fight against a disease. The corrective approach, when the action starts, normally when the damage is already done, the cost of the treatment are very high, and there is an important impact on productivity and profitability derived from the mortality and the low performance. It may be hidden cost, very important hidden costs. The preventive approach, our approach as Adisse, is to start the action before the problem is established, to prevent, to apply a preventive or biosecurity strategy towards infectious diseases in aquaculture. Therefore, the cost of the treatment and the monitoring program will be lower than the corrective approaches, and there is going to be a clear increase in productivity and profitability, a reduction of the disease risk, and improvement of the profitability with better health or through better health. So therefore, holistic and integrated preventive approaches, including biosecurity, better husbandry practices, functional additives, coherent and responsible use of chemicals and antimicrobials should be considered when we are thinking about how to manage infectious diseases and multi-infectious diseases in aquaculture. Because we know that a single solution is not valid in aquatic ecosystems. A single product won't solve the problem when we are having similar and several pathogens at the same time. in a disease situation or a disease outbreak, Adisse is actually promoting broad spectrum health additives, for example, organic acids that are very known and commonly applied also in terrestrial animals to reduce pathogen load with a clear antimicrobial activity and antiparasitic activity. And also, for example, compounds or functional additives based on phytobiotics that we are going to have a double effect, reducing pathogenic load, so we will act at the level of the pathogen, and also increasing, improving, or enhancing the disease resistance in the host. So we are actually acting at the level of the pathogen and at the level of the host. And at the level of the host, we can increase disease resistance by having a much better gut flora modulation, antioxidant support, gut integrity, and gut health, and also immune modulation. The real situation, as I said before, in aquaculture is that in most cases in disease outbreaks, we are not facing a single pathogen or a single pathogenic agent, but multiple infections, co-infections. Co-infection is the simultaneous infection by multiple pathogen agents. One of them can be primary, the root cause of the disease, and maybe the others are considered secondary or opportunistic, or we can say commensals, a sequel or complication of the root cause. Normally, single host pathogen infections are quite uncommon in aquatic ecosystems, and co-infections or multiple infections, also called multifactorial infections, are extremely common in aquaculture. There are also other definitions that might be useful for you to consider. Superinfection normally is an infection that is following a previous one, especially when the microorganisms causing the disease are resistant to the antibiotics or antimicrobial used earlier. And a co-infection is considered when both pathogens are acting at the same time. Multiple infections, of course, can be synergistic, when there is an increase in the severity of the disease, and antagonistic, when there is a decrease in the severity of the disease. So they can modify actually the course and the pathogenicity of the agents, the course of the disease. And just to give you some practical examples from the real world, from the farming environment, we know that in tilapia, during the farming period from hatchery until grow out, we can face lots of pathogens one after the other, either in co-infection or superinfection or multiple infections. At the end of the day, it's an open aquaculture system. And for example, this is some information from Thailand collected by Kassersat University, where we can see that some pathogens like Flowbacterium columnare, for example, can start from the hatchery period until mid-grow out. And it's normally combined during the hatchery and nursery with Francisella and iridoviruses. Later on, depending on the season, but during the hot season, it's also sometimes found together with Streptococcus and Aeromonas hydrophila. And of course, external parasites, monogeneans and protozoa can be found in our animals all along the production system together with fungi and these bacterial diseases. And the same is happening in shrimp farming, as most of you know. It's also an open aquaculture system. In a more closed system like RAS or bioflux, the situation might be slightly different, although still focused on quite a lot of multiple pathogens. This is an example from Indonesia, from South Java, where we can see that EMS is starting around the OC18, followed by the detection of white spot, and EHP and IMMB by the end of the grow out around the OC70. So a multifactorial also situation, quite complex in terms of pathogens. So do you think with a situation like this, with several pathogens, complex environment, high levels of stress, difficult, we can say, farming conditions for an aquatic organisms, at the end of the day, a single bullet will work against these multifactorial infectious diseases? Well, we know that it's not the case, and this is why we advocate for broad spectrum functional additives that are combined or integrated into a holistic preventive program. As I said before, trying to find different modes of actions, multiple modes of actions, either at the pathogen or at the host, both together, and also at the level of the environment. So I'm going to go quite quickly into the tilapia trial results. This is a trial result from an in vitro laboratory trial where there was a co-challenge of tilapia lake virus and Aeromonas hydrophila. This is a model that has been developed by Gassersat University, where we can see that a combination of these two pathogens, tilapia lake virus and Aeromonas hydrophila, in co-infection can cause 93% mortality. Single tilapia lake virus 35 and single Aeromonas hydrophila only 6.7. So Aeromonas hydrophila can be considered actually as a real opportunistic pathogen with a relatively low mortality. But when combined with tilapia lake virus, when animals are weaker and the immune system is reduced, this is less strong because of this. Tilapia lake virus Aeromonas hydrophila can cause up to 93% mortality. The information about and the data regarding the strains and the presence of these two pathogens in Thailand farms was collected during a long period of surveillance in 2019 and 2020. And this is the co-infection trial experimental design. There was an acclimation period of 21 days, followed by a challenge with tilapia lake virus on day 0, and a challenge with Aeromonas hydrophila on day 3. And then these animals were monitored for 21 days. There were 3 groups: non-infected, control diet, the control negative; the infected, control diet, control positive without any additive; then a 3rd group with Bactimil aqua. It's an organic acid-based additive, synergistic blend of medium chain and short chain organic acids. So these 3 groups, negative control, positive control, and Bactimil, were evaluated during these 21 days post-challenge. As I said, tilapia lake virus on day 0, Aeromonas hydrophila on day 3, and the difference in mortality after this co-infection challenge was quite significant. There was a reduction of 38% in mortality comparing the control positive, no additive, with the organic acid-based additive. So we see that actually organic acids can be very effective in reducing mostly bacterial infections that, combined with viruses, can increase the mortality, increase the severity and the pathogenicity of this co-infection situation. Going into the shrimp trial results, this is a trial focused on a health program to reduce the severity of white feces syndrome in Indonesia. White feces syndrome was detected in this farm in Indonesia during the last 4 crops around the OC 30 to 40 with a survival maximum of 50% and a not very good FCR 1.7. The Vibrio load was also quite high in pond water, and there was most of the ponds were also positive to EHP by PCR combined with Vibrio, and clinical signs associated with white feces and symptoms associated with white feces in the past 4 crops around the OC 30 to 40. This trial was designed to compare 2 possible approaches when applying a phytobiotic-based additive. In this case, it's not an organic-based additive, but a phytobiotic-based additive composed of phytobiotic compounds, organic acids, and yeast extracts. As I said, 2 approaches were compared: a corrective approach where the animals were treated only during the high-risk period, DOC 30-40, and a preventive plus corrective approach where the animals were treated with a low dose for the entire grow-out plus a high dose of the additive during the high-risk period, DOC 30-40. So these 2 possible approaches were evaluated with 10 ponds each approach, 100 PLs per square meter, same starting day, same stocking density, same PL origin. The difference was the preventive and corrective versus corrective approach. And this is a summary of the results based on the survival, where we can see an important increase of 169% when we compare the no supplementation, the control negative, with the preventive and corrective approach, and also the biomass and the FCR. There is a reduction of 32% in FCR when comparing the no supplementation, the negative control, with the preventive plus corrective. As I said before, preventive plus corrective, we apply the additive for low dose for the entire grow out, plus a high dose during the high risk period of 10 to 14 days in DOC 30 to 40. Regarding the role, we also saw important differences comparing the corrective approach, only treatment during the high risk period, and the corrective plus preventive approach. And during this trial in Indonesia, because of the number of ponds involved and the relevance of the preventive versus corrective strategy comparison, we also wanted to do some evaluation of the carbon footprint of shrimp farming historical data compared to corrective treatment and compared to preventive and corrective treatment, and evaluate if there was any decrease, any reduction on the emission of CO2 per kilogram of shrimp. We saw an important reduction of the carbon footprint in the preventive plus corrective approach, 39% reduction. There is an important reduction of the aquaculture farm direct and indirect emissions, and of course a reduction in feed, clear reduction in feed. These normally evaluations are not conducted by Adisse itself, but by other organisms, third-party consultants who are specialized in the evaluation of CO2 emissions in aquaculture. But it's very interesting to see that preventive approaches can have such an impact in the carbon footprint of shrimp farming nowadays. This is getting very important every day, not only in Asia, but also in other regions of the world. And then lastly, I would like to show you very quickly a trial focused on the whitefish syndrome, again, Vibrio parahaemolyticus, where we conducted a trial in Mexico at the CR with Vibrio parahaemolyticus in shrimp, a challenge trial at the laboratory, testing again the organic-based additive that we mentioned in the first trial with tilapia, Bactinil aqua. The experimental design was very similar to others that I have mentioned before, control negative, no additive, control positive, no additive, plus challenge with Vibrio parahaemolyticus, highly pathogenic Vibrio parahaemolyticus, the causative agent of EMS or AHPND, and then animals challenged by Vibrio treated with this organic acid-based additive at 0.3%. The animals were around 4 to 5 grams, 29 degrees, 10 shrimp per aquaria, and the duration of the trial was 24 hours, just to see the mortality results after the application of this additive to reduce the impact of Vibrio parahaemolyticus. Of course, the animals affected by Vibrio parahaemolyticus showed important clinical signs like reddish color of antennae, muscular opacity, hepatopancreas discoloration, or the cubitus positioning. And we saw a very important increase in survival of 5 times more survival, 60% survival in animals treated with Bactinil compared to 13% survival for control positive. Of course, control negative, no challenged animals were 100% survival. Therefore, to conclude, some slides on the histopathological evaluation analysis of these 3 groups. Control negative, of course, no important histopathological findings. Control positive, no additive. We see cellular detachment of hepatopancreatic tubules and hemolymph infiltration in proximal intestine. And for the organic acid-based additive, Bactinil aqua, we see a normal hepatopancreas tubules, although there is some infiltration of hemolymph because of the infection of the Vibrio infection. Some take-home messages regarding functional additives and how these functional additives can be integrated into a holistic preventive program. They are, of course, a key tool in preventive health management, and they can enhance the health status of farm stock and also reduce the pathogenicity or the pathogen load. They are broad spectrum with inhibitory activity against infectious agents, a broad range of infectious agents, including viruses, bacteria, and also there are functional additives devoted for external and internal parasites as well as fungi. They can be devoted to maintain gut health, gut integrity, and gut modulation, and enhance and balance immune response. And they have shown to be very effective in multiple infections and also co-infections. Single additives also may have multiple and synergistic effects. So putting together different functional additives with different modes of action can give us a synergistic effect across species, which is extremely relevant in the feed industry, where we can use the same additive or the same formulation for a different species with similar results. Thank you very much for your attention, and I wish you have had a very nice workshop. Thanks indeed.